Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're tackling something that might be the hidden reason behind your bloating, your fatigue, or even your brain fog. It's called small intestinal bacterial overgrowth, or for short, SIBO. Joining us today is someone who's passionate about gut health and integrative healing. Please welcome Dr. Bryn Henderson. Dr. Henderson is a board-certified physician known for combining advanced diagnostics with innovative therapies, including regenerative medicine, microbiome support, and much more. In his clinic, he uses brain mapping and offers support with peptides for cognitive function. Today, we explore how SIBO affects both body and mind. Dr. Henderson, let's start with something easy. What is SIBO?
Okay. SIBO stands for small intestinal bacterial overgrowth. Normally, your small intestine doesn't have many bacteria. That job belongs mainly to the large intestine. But in SIBO, bacteria that should stay in the large colon move up into the small intestine and start to multiply. This can make a mess of digestion and lead to symptoms like bloating, gas, and diarrhea. It also blocks nutrients from being absorbed properly, which can cause fatigue, vitamin deficiencies, and of course, weight loss over time.
Okay, so what causes these bacteria to suddenly overgrow? And more than that, how do they move up the colon into the intestines?
Yeah, they were going the wrong way, right?
Yeah.
Well, that's a good question, a great question, actually. SIBO usually happens when something slows down the movement of food and bacteria through the gut, like diabetes, hypothyroid, scar tissue from a surgery, or certain medications like protein pump inhibitors. It can also happen if the valve between the small intestine and the large intestine is not working properly, or if your immune system is weakened. In some people, it's linked to genetic issues or even birth-related structural problems. But there's something we don't talk about enough, and that's the vagus nerve. It's the main nerve that connects the brain to the digestive system and tells your gut to keep things moving. If the vagus nerve isn't functioning well due to chronic stress, nerve injury, or even poor posture, it can slow digestion and lead to bacterial buildup. Even things like neck strain or spinal misalignment can interfere with this nerve. In fact, some patients benefit from gentle neck manipulation or therapies aimed at stimulating the vagus nerve to help restore gut motility and prevent recurrence.
Well, what are some of the most common signs or symptoms of this SIBO that our listeners can look for?
The most common symptoms are bloating right after eating, excessive gas, diarrhea or constipation, or sometimes both, and abdominal discomfort. It just doesn't feel right inside. In more serious cases, people may lose weight without trying. They feel very tired and have brain fog. SIBO can also cause vitamin deficiencies, especially B12 and the fat-soluble vitamins like A, D, E, and K, which can affect skin, bones, and even your nerves.
Is there a way to test for it?
Yes. Most common and non-invasive test is a breath test. A breath test is easy. You drink a little sugar solution, like lactose or glucose, and we measure the gases you breathe out, like hydrogen and methane. If those gases spike early, it suggests there's too much bacteria in the small intestine. And it's the gold standard is a culture taken from the small intestine itself. But that's rarely done or even necessary.
What is this breath test?
Well, as we suggested, after taking some sugar, we determine what the exhalation, in other words, when you breathe out, what are you breathing out?
Is it like doing H. pylori breath test?
Yes.
Same machine?
Yeah, it's a breath test. It's not invasive. You just blow or measure your hydrogen or methane gases in the patient's breath after the consuming of the sugar solution. An increase in these gases, particularly within a specific time frame after the sugar is ingested, can indicate a bacterial overgrowth in the small intestine. It's simple.
Okay. So now, how do we get to treatment?
And the treatment usually involves 4 things: antibiotics to reduce excess bacteria, diet changes, especially a special diet that cuts down on fermentable carbs. Treating the root cause is third. Correcting the gut motility, that's called peristalsis, and avoiding medications that worsen SIBO. Fourth is the probiotics or herbs that help you balance the gut. In tough cases, we also consider elemental diets or advanced treatments like fecal transplants or even regenerative cell therapy.
All right, so you mentioned herbal and natural treatments. Can you explain more about those?
Certainly. The herbs like berberine and oregano oil have been shown to work just as well as antibiotics in small studies. We also use Chinese herbs that help reduce inflammation and support digestion. And Chinese herbal polysaccharides, like those from ginseng and asparagus, act as natural prebiotics. They feed the good bacteria and help heal the gut lining. That reduces the harmful bacteria.
So you mentioned before that SIBO is linked to other illnesses. Let's go in a little deeper with that. You mentioned diabetes, hypothyroidism, scar tissue from surgeries, and proton pump inhibitors. Hello, do you know how many people take proton pump inhibitors every day? I write those prescriptions probably 10 people a day.
Oh, wow.
And they're hooked on it.
It decreases their acid, so it makes them feel better.
Yeah.
But in any event, the question was, what's SIBO associated with? And it shows up in people who have IBS, irritable bowel syndrome, Crohn's, celiac disease, and as Helen noted, diabetes and autoimmune conditions. Those autoimmune conditions are things like scleroderma and Hashimoto's, and it can also worsen liver conditions, especially cirrhosis, and it's been associated with rosacea and even mood disorders like anxiety and depression.
All right, let's talk traditional Chinese medicine. How does it explain or treat SIBO?
Traditional Chinese medicine is fascinating. In SIBO, it's seen as a disharmony between the spleen and the stomach. It's a buildup of what they call damp heat in the gut. So acupuncture points like ST36 and CV12 are used to support digestion and reduce bloating. The traditional Chinese medicine focuses on restoring balance. Balance is the major theme of most of Chinese medicine. So this improves gut motility and it calms the stress that often triggers gut issues. Many patients feel noticeable relief when combining acupuncture and herbal formulas.
All right, let's move on to newer therapies, regenerative therapies, and the things that are in your heart to move along medicine to the future.
I agree. There's quite a controversy regarding the fecal microbiota transplants, and they haven't really caught on because they're fecal.
Yeah.
But in any event, that is a way of introducing healthy bacteria into the gut. An alternative way is with the regenerative therapies because they help restore new cells. They help repair the gut lining and restore the balance, just like the Chinese medicine does. This is an exciting area in gastroenterology because we don't just kill bacteria, we help the gut heal. And helping the gut heal keeps us in a better balance and staying healthy.
All right, so can SIBO come back after somebody has treatment?
Unfortunately, the answer to that is yes. Up to 45% of the patients can have a recurrence within 6 to 9 months. That's why long-term care is really important here. We use follow-up breath tests, support gut motility with mild medications, and recommend a lifestyle change and dietary maintenance. Avoiding triggers like chronic use of PPIs that's the protein inhibitors, and treating underlying issues like the motility, maybe with manipulation, etc., can help natural therapies reduce chances of relapse.
So, a personal question, how do I tell my patients that their bloating is coming from the very pill that they're swallowing, the protein pump inhibitors like omeprazole and famotidine and all of these things?
There's no question the best way
to say it.
The way I would say it is I'd have them take a holiday, take a week off of those meds and give them an alternative that's more, quote, natural, unquote.
Okay, so when should someone suspect that they might have SIBO and come into your office and get tested?
If you constantly feel bloated after meals or have chronic gas or unpredictable bowel movements, either way, constipation or diarrhea, or experience brain fog, now you're at the other end, right? And fatigue with no clear reason, it's time to ask your doctor, especially if you have a condition like irritable bowel syndrome, celiac disease, diabetes, any food intolerance. SIBO could be a hidden issue. Testing is quick, affordable, so it's worth checking out.
Can children get SIBO?
Yes, unfortunately, that's true. And kids' SIBO looks quite a bit like irritability and difficulty sleeping and stomach pain, poor appetite. We call it failure to thrive. If a child has frequent food sensitivities or developmental delays without a clear cause, SIBO needs to be right up there and considered, especially in toddlers and those with chronic tummy issues.
All right. Before we wrap up here, Dr. Henderson, what are some of the things that you want to advise our listeners right now who suspect they may have SIBO but feel overwhelmed?
It's a very sensitive question. The main thing to begin with is don't ignore your symptoms. Listen to your body. Don't try to power through them. SIBO is more common than most people think, and it's treatable, and it causes ramifications into all kinds of body systems because it's the vagus nerve. So you don't have to figure it out alone. We'll help you. Start by speaking with a healthcare provider who listens, understands gut health, and with the right plan, healing is absolutely possible in pretty short order. And in fact, we have a mnemonic we use, and I'm pretty sure it'll help you remember to take better care of this part of your health. With the right plan, healing is absolutely possible, and that's where our SIBO Relief Guide can help. The SIBO Relief is a gentle plan to manage small intestinal bacterial overgrowth. S stands for see a specialist, a gastroenterologist or your family physician for the proper diagnosis. I stands for identify your symptoms, track bloating, gas, abdominal pain, diarrhea, or constipation. B stands for breathe and manage stress. Stress just causes anything, but it really slows the gut motility into wild, different ways. Mindfulness and relaxation really help. O is optimize your diet. SIBO specific diets reduce symptoms. It's good. R stands for restore balance with a treatment. Take prescribed medications or herbal remedies to reduce bacterial overgrowth. E is for ease into probiotics carefully. Use only as advised. Not all probiotics are helpful during SIBO. L, limit snacking. The spacing the meals becomes a big deal, and it allows for the migrating motor complex to clear bacteria. I is to improve gut motility. Motility is a big deal here. Walking after meals or light exercises using prokinetics may help move the food and bacteria along. E is eliminate underlying causes. Address root causes like low stomach acid, irritable bowel, or structural GI issues. F, follow up regularly. Reassess your symptoms and retest as needed to monitor the progress. These chronic illnesses need to have accountability with your provider and yourself on the same page.
Thank you, Dr. Henderson, for walking us through the world of SIBO in such a way that we can understand it better. I'm sure many of our listeners have never heard of it, but they have had bloating, they've had brain fog, they just didn't know that it was their gut. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.